Hello, I'm Pamela Rochelle, Regional Director for the U.S. Department of Health and Human Services. If you know anyone who is uninsured, connect them to affordable health coverage through the health insurance marketplace. The Southeast region has a very high concentration of uninsured African Americans. In South Carolina, more than 260,000 African Americans are uninsured. That's enough people to fill Williams-Brice Stadium at the University of South Carolina 3 times, or the Oliver Dawson Stadium at South Carolina State University 12 times. On March 23, 2010, President Obama signed the Affordable Care Act. The law puts in place comprehensive health insurance reforms that will roll out over 4 years and beyond. The health insurance marketplace, commonly known as Obamacare, is only one part of the Affordable Care Act. For the first time in the history of the private health insurance market, people in every state are able to shop in one place to assess coverage options, get accurate information, and make side-by-side comparisons of plans before making decisions. This is an historic time in the history of healthcare in our nation. Getting covered is especially important for the African American community. Approximately 36% of African Americans in South Carolina are uninsured, and we often have higher rates of serious disease and are less likely to receive preventative care. The good news is all health plans in the health insurance marketplace must cover preventative services without charging a copay or coinsurance. This applies even if you have not met your yearly deductible. You've probably heard about applying for coverage on healthcare.gov, and I'm happy to report that the website is working smoothly. What you probably have not heard is that there are 4 ways to apply for coverage: online, by phone, in person, or by paper application. By far, enrolling online is the fastest way to get coverage now that the website is performing well. The health insurance marketplace employs a call center that is available 24 hours a day, 7 days per week. Call to get questions answered, ask for a paper application, find help in your community, or apply by phone. So here are the 4 ways to apply. You may apply online by visiting healthcare.gov to get started. Apply by phone. You can call 1-800-318-2596. Apply in person by visiting a trained counselor in your community. Log on to localhelp.healthcare.gov or contact the call center to find a trained counselor near you. Apply by mail. You may download the paper application and instructions from healthcare.gov or call the marketplace at 1-800-318-2596 to request a paper application and instructions. There are over 260,000 uninsured African Americans in South Carolina. So what can you do to connect people to coverage? Here are 3 basic steps. First, call the Marketplace call center. Tell everyone you know about the call center. Call 1-800-318-2596, 24 hours a day, 7 days a week, to get questions answered, request a paper application, find in-person assistance near you, or apply by phone. Second, get accurate information. Distribute accurate information to your family and community about the marketplace. Log on to marketplace.cms.gov. That's marketplace.cms.gov to access free official resources. Third, enroll by March 31st, 2014. Open enrollment ends on March 31st. Remember, approximately 6 in 10 eligible uninsured African Americans in the United States could obtain financial assistance in the marketplace. The only way to know if you qualify for help with paying your premiums is to apply. Trained counselors are available to assist you at each of the 19 community health centers throughout the state, and South Carolina has 3 organizations devoted to helping you with enrollment. They are called navigators. The navigator organizations are the Beaufort County Black Chamber of Commerce with a service area covering the Low Country, the Cooperative Ministries with a service area covering the Midlands, and DECO, a statewide service area. SignUpSC.org is a website developed and managed by the South Carolina Appleseed Legal Justice Center that provides accurate, up-to-date information on the health insurance marketplace. Visit the website to find out about events in the community. At signupsc.org, you will find information about education and enrollment events near you. Remember, open enrollment ends on March 31st, 2014. You can apply by calling the call center at 1-800-318-2596, online at healthcare.gov, by mail or in person. Thank you for connecting the uninsured to affordable health coverage in the health insurance marketplace.